afternoon and welcome to our weekly media briefing and public health update with Montgomery County Executive Mark Elrich. I'm Lorna Virgilia, Hispanic Public Information Officer, and joining us today is Dr. Keisha Davis, the County Health Officer, as well as Dr. James Bridgers, Director of the Department of Health and Human Services, and Mr. Sean O'Donnell, Program Administrator, Public Health, Emergency Preparedness and Response, also for the Department of Health and Human Services. Today we have a special guest. His name is Mr. John Bonger, and he is the Director of the Department of Health and, I'm sorry, no more health, the Department of Environmental Protection. Sorry, John. And with that, I'm going to toss it to you, Mr. County Executive.
Thank you.
Good afternoon.
I'm sure John is happy where he is and does. He's got enough problems to deal with. So I just want to welcome everybody and thank you for joining us today. I'm going to start with news about Maryland Task Force 1. Consists of 50 members and 2 of our canines from Montgomery County Fire and Rescue Service who arrived in Hawaii on Saturday as part of the FEMA Urban Search and Rescue Team. They've been deployed to help sift through the massive devastation there that was caused by the wildfires. And authorities, as of this morning, were saying there are like, more than 1,000 people missing right now. Our county's contributing about 10% of the workforce, actually over 10% of the workforce that's being deployed for this effort. So our contribution is meaningful. And this team's expected to be there for 2 weeks. And this is going to be very physically and emotionally challenging work. And I deeply appreciate the willingness of the folks going over there to participate in this deployment. And I hope they have a safe tour of duty and return here safely. With barely any notice or warning to flee these fires, survivors have lost their homes and possessions. And even with federal assistance, many of these families are going to need more aid and help. So I'd encourage Montgomery County residents to please donate to the Red Cross, as well as other aid organizations that are working directly with the victims over there. These wildfires in Hawaii, as well as hurricanes in Texas and California and Haiti, as well as tropical storms and new wildfires starting in British Columbia, Canada, Tenerife, just all over the world. Rising ocean temperatures, Florida at 100 degrees, warming in the North Atlantic that is really worrying, and record heat waves that we know a little bit about here, but fortunately nothing like Phoenix, which went over 30 days over 110 degrees. These are all examples of deadly impacts from climate change. And the more we can do to protect our environment, improve sustainability, and eliminate greenhouse gases here at home, and working together as a community, the better off we're going to be. I'm going to say this every time we have these discussions. We're not telling you that Montgomery County is going to save the world, but the things we do in Montgomery County open the door for other people to see what can be done. I think, a lot of us just know what's possible, but there are a lot of people in this country and in the world who look at this problem and have not a clue what to do and don't know where to begin. And one of the things this county can contribute, and hopefully will continue to contribute, is a willingness and the ability to set a direction that other people can look at and see that it works. So I'm encouraged about what we do. But the truth is the world, and including our own country, which has been one of the worst in this regard, have dithered and delayed actions that could have avoided or mitigated these threats. I was reading a story this morning about the scientist who talked about how they warned people about this 4 decades ago. And it was all dismissed. And we were told that this was likely to happen, yet, major corporations, particularly in fossil fuels, that literally fueled greenhouse gas emissions, have deliberately misled the American people about what they knew and when they knew it. They did their own studies that told them what they were going to do was going to produce global warming. And while they were doing those studies, they spent millions of dollars on ads, basically to minimizing global warming and pretending like it wasn't real. Today, we're faced with enormous costs just to minimize the damage they caused. And the corporate expectation is the public is going to foot the bill. And I got to say, in a way, this is parallel to what's happening with the opioids and fentanyl, where drug companies knowingly push these dangerous drugs into the community. They knew they were being misused. They knew they were fueling addiction, and they were causing deaths. And they were still getting advice from their consultants on how they could sell even more drugs and increase their profits. So while the county, there are lawsuits out there, the county's participating, we're getting some of the settlement money. The truth is the money doesn't come close to what it's costing us. And the affected individuals and families, they're all being affected by this. It all has costs to these families. And we're not getting the help we need to address the harm. And the companies are paying a fraction. And of course, true to form for most corporate crimes, none of these people ever go to jail. It's amazing. You can be a major corporation, push drugs into a community, knowing what the effects are going to be, and you have no personal liability for that. Must be nice. On a local and positive note, this summer, Montgomery County welcomed the new director for our Department of Environmental Protection. John Munger spent years developing policies at the EPA and in the halls of Congress and the White House to improve our environment. And his experience being a special investigator on environmental disasters like the Deepwater Horizon oil spill gives him experiences and insights like few environmental leaders have. And when John interviewed with us for this position, I could tell not only that he had a sense of urgency about the work, but he's also a passionate and effective leader with a proven track record of leading in this space. And that's the important thing. We can think about it and care about it, but we also have to lead and execute. And I have a lot of confidence in John's ability to lead and execute. So I'm happy to introduce him to you today and talk a little bit about his background and his work and why I decided to bring his talents to Montgomery County. So welcome, John.
Thank you, County Executive Elrich, for that kind introduction and your terrific leadership, and for your nomination of me as Director of Department of Environmental Protection. It's just a tremendous honor to be serving you and the people of this great county. As the county executive said, I've spent my career working on some of the most pressing environmental issues that we've faced. After law school at Catholic University, my first job as the county executive was actually counsel to a presidential commission set up to investigate the BP Deepwater Horizon oil spill, which, in addition to being one of the largest environmental disasters ever, tragically also claimed the lives of 11 individuals. I also served as counsel in the U.S. House of Representatives and at the U.S. Environmental Protection Agency under Presidents Obama and again with President Biden and his administration. And I'm excited to join Montgomery County because ultimately the work of protecting the environment is also about enhancing human health and quality of life in communities like those all across Montgomery County. So Lorna, you are completely forgiven and understood when you called me the Director of Health. Although I think Dr. Bridgers and I we have really related missions here, and Dr. Bridgers and I also roll as a pack in that we were both had our confirmation hearings with council on the same day. But the missions of our two departments are really inextricably linked, because when we're working on protecting the environment, there's also always links with human health and quality of life of our own families, of our neighbors, and of everybody in our community. So I'm actually really it's really great to be joined by my colleague today and appreciate that introduction. And as the county executive discussed, you only need to look out the window or look at the headlines of the day to see that we are already living with the impacts of climate change. So as the county executive mentioned, we have resources deployed in support of the ongoing recovery efforts in the deadly wildfires in Maui. Reportedly, those fires were advancing at a rate of approximately a mile a minute. Another way I heard it described was the length of a football field in just 5 seconds. So these challenges are real and in many times very, very sadly fatal, as we've seen with this disaster. But right here in Montgomery County and across the entire eastern seaboard of the U.S., we also saw earlier this summer our schools and businesses closed due to dangerous smoke from wildfires hundreds of miles away. So this is something that's affecting us every day in our communities right here in Montgomery County. And while the challenges are really great, that's really clear. What's less clear is that the opportunity to work on them and make a positive impact is really great right now as well. So right now, there's once in a generation sized investments being made on climate and the environment through the bipartisan infrastructure law and the Inflation Reduction Act. Hundreds of billions of dollars are being put out in really targeted ways to make a real difference that we haven't made in our entire lifetimes when it comes to protecting our environment. So this is the moment that many people have been waiting for, where there's actually a significant amount of federal resources being put out there to make a difference. And it's particularly exciting for Montgomery County because here in Montgomery County, we are prepared and organized, and importantly, there's a record of environmental leadership, as the county executive was describing, not only within Maryland and in the Washington metropolitan region, but really across the entire nation. We have that record of leading on this issue. And I just want to close by underscoring that while environmental challenges affect everybody, we know that the impact of these challenges is far from equal. History and data has shown that too often minority and overburdened communities are disproportionately impacted by environmental hazards. So I look forward to continuing to apply a robust equity lens to all of the environmental work that we're doing here in the county, working with local communities, working with the County Office of Racial Equity and Social Justice to really ensure environmental justice issues remain front and center in all of DEP's work. So with that, so excited to serve County Executive, and thank you so much for the introduction today.
Thank you, Director Munger. Members of the media will take questions right now regarding environmental issues, general questions, as you all know, at the end of the presentation. Raise your hand if you have any questions right now for Director Munger and or the County Executive related to the environment. Raise your hand. No questions on this topic? Going once, twice. Thank you, Director, for joining us. Director from the Department of Environmental Protection. Thank you for joining us.
Thank you so much, Lorna. Good to see you.
Likewise, you can stay or you can drop off if you need to go. Mr. County Executive.
So a couple of even more local issues. A new plan for the Maryland portion of the Capital Beltway and I-270 is going to be developed by the Maryland Department of Transportation at the request of Governor Wes Moore. And importantly, the proposal will not include the $6 billion public-private partnership developed and championed by the Hogan administration with Transurban, which was an Australian company. Governor Hogan's proposal was designed to provide revenue and increase the value of the stock for Transurban shareholders, not to relieve congestion for Maryland motorists or provide transportation options. I'm pleased by Governor Moore's announcement that MDOT will pursue a $2.4 billion grant to pay for needed improvements to the road and fix the American Legion Bridge first. I'm happy for two reasons. One is that I advocated from the very beginning that this project should start at the American Legion Bridge. When you've got a known plug from which, the bottlenecks back up from, you fix the plug and then you figure out what you need to do along the rest of the way. But you can't get a true picture of how that road functions unless you remove the plug at the American Legion Bridge. And so this is really important. And I'm really glad that they're going after federal money. That was one of the great frustrations with Hogan. The cost of those enormous tolls was partly based on his refusal to get any federal grant money, which I found curious, baffling, and not good public policy. So I'm glad that this administration is starting with that approach. With President Biden's emphasis on infrastructure and the passage of the Inflation Reduction Act last year, the state should have been pursuing the funding. And I think that, this is at least get us started in the right direction. And additionally, Governor Moore is actually talking about transit in his plan, which is a significant departure from the previous administration. And it's a key to success in relieving traffic congestion for our residents. He understands that traffic congestion isn't solved by just adding lanes alone, but we've got to give people reasons to get out of their cars at the end of the day. And so, we've had conversations that involve both enhancing the rail connections into Western Maryland north of us, and as well as for expanding bus opportunities, whether it's express bus or bus rapid transit. These things all have to fit together comprehensively in the plan. And I've had 2 conversations with the governor's staff so far, and there's no build out plan yet to be determined. And that's why I was comfortable saying good things about where we are right now. They're going to work from the south to the north in developing a solution. They've talked about the other non-road enhancements. They've talked about doing this as a complete project from here to Frederick rather than stopping at the ICC, which was a major disaster for Montgomery County. I mean, if you all remember the discussion, if you added lanes to 270 going north and they all end at the ICC, the additional traffic that would now be compressed into the existing roadway would just be a mess. And this does what I think needed to be done from the beginning, which is a holistic approach to solving this problem. I think as a whole, the administration is studying its options, but they're also aware of broader community issues. And he talked about that as a candidate, and he's talked about that, since he's been governor, that he's aware that there are community issues that they need to be aware of and they need to work with. I know some people are concerned about accepting the record of decision, but the record of decision is not the same as accepting the Hogan plan. And I think some people have confused that if you accept the record of decision, you automatically affect the Hogan plan. The big thing about the record of decision, it kind of set the outer limits of where this project could go. And if they had to start over again, we'd be back spending a couple of years first designing a new project and then going through a record of decision. With the record of decision, they can make changes to the plan. They just can't go outside the boundaries that were specified in the plan. And for me, that's good news because most of the boundaries in the plan are where they should be. And the ones that aren't where they should be, we can find solutions to that'll keep us from getting into the communities and being able to avoid the problems that were inherent in the governor's plan. I would have been disappointed if they had said we're doing the governor's plan because that's not what any of us were bargaining for. So I'm happy that we're at the point we are now. We're going to have a lot of opportunities to work with the governor. One of the things about, again, looking at the parameters of the plan, if you built Hogan's plan, the governor could never achieve his goals of controlling costs. He would not be able to bring tolls down. He would not be able to bring the cost of the project down. So given his goal of trying to tame this project and bring it back into a reasonable level, I'm convinced you're not going to wind up with a redo of just what the governor proposed. So I'm comfortable where we are with this. And while their statement references managed lanes without an actual new design, complete with cost estimates, it's premature to determine whether tolls would actually be necessary. I know that they're working with numbers that came out of the previous plan. They were pretty enormous numbers. I'm hopeful as the state gets into really examining the I-270 portion, which, even Greg Slater agreed could be largely built within the confines of a footprint. Easy to build if you use reversible lanes, still possible to build if you do 2 lanes in each direction. But there's actually a reasonable solution for dealing with this there. And that would take a lot of the enormous costs that Hogan had in this project because his design for 270 was way out of bounds. Fortunately, it would also be outside the record of decision in a lot of ways. So I'm okay with where they are in the moment. If the state receives significant federal investment, I'm sure they'll look at what it's going to take to fund their share of this project. And I'm optimistic they'll look at long-term bonds instead of using tolls for the revenues. I continue to believe that constructing this as a P3, at least as was previously envisioned, that P3 will do nothing but drive up the cost of the project. One example is the state was relying on the P3 to borrow money. So the P3 would not only borrow money at a higher rate than the state could have gotten it for, but they expected a profit on the money they were borrowing. So they just didn't expect to be paid back for what they borrowed, but they expected to profit on that. There is no way you can control costs if the P3 is going to be your borrowing agent. So if we wind up in a design build project, that's one thing, but I certainly don't want to get to the point where the P3 is in charge of financing this project. That will not work for county or other residents of the state, because it'll simply make this project more expensive than it needs to be. And we don't need to make it more expensive than it needs to be. The Moore administration has clearly expressed a desire to ensure that they're going to meaningfully engage the public. I have no reason to assume that they won't. So I encourage people to stay engaged, be vocal about their concerns. And I'm confident that if we work in a true collaborative fashion, we can find real solutions to this issue that include our community and resolves issues in a physically prudent manner. They're already looking, as I said, at enhancing things like transit and rail service, which was important to a lot of the advocates who rightly criticized the Hogan plan for ignoring these things. So there's a lot of time and there's a lot of motivation for them to get it right. And if we don't get to a good place, obviously there's going to be time to object. But this time, other than the mention of tolls, they haven't developed a design that we can say, or at least I can say, that I oppose. There is nothing on paper you can look at and say whether or not this is going to be acceptable or whether this is not going to be acceptable. So, you know me, I haven't been shy in the past. I'm not going to be shy going forward, but we're going to try to create a collaborative approach, emphasizing community involvement, focusing on transit, minimizing community impacts, developing a cost-effective, efficient plan, starting with the bridge. So I think we're at a good starting place, and hopefully we'll stay on track. The other topic, big topic I want to talk about is the situation MCPS around the principal. I want to reiterate my call for an independent investigation to look into the sexual harassment allegations that were made against a now suspended principal. I'm bringing this up again because MCPS decided to go forward with hiring a law firm with a history of representing Montgomery County Public Schools to investigate this matter. MCPS is utilizing a law firm that does significant amount of work for them. And this is not going to engender the public trust that the school system needs. It's possible, that they could look at this and give a fair report, but you're always going to have the public wondering, was this thing colored by the relationships with the school system? And frankly, the possibility that some of the people who are responsible for not reporting information adequately in the chain of command over there may be people who are part of this, of the school's leadership team. And so I think having a fair look at this is critically important. I support, the county IG doing this if they have the capacity to do it. Alternatively, if they don't have the capacity, the state IG could be asked to do this, or a special investigator reporting to the IG could be retained. But the IG, whether it's the state or county, should select the company doing the investigation. There's no reason that a company with the school system would have any special knowledge about this. And if they did, it would be really disappointing, having not done anything about the problem. If it exists for years, it would be bad if they had any special knowledge that everybody else wouldn't have or wouldn't be able to obtain by an investigation. It's already come out. There are other allegations. Some of them are longstanding. So any look at this requires looking beyond just the issue with this one principal. Resolving the questions and concerns is vital for both the community and staff, and I hope MCPS is willing to change course here to ensure a true independent investigation. This is one of those things where the appearance of what you're doing actually matters. And one would assume that any properly done investigation would reach the same conclusions. And there are multiple entities capable of doing this. This law firm has no special ability to do this. So why not pick an investigator that doesn't trigger concerns in the community over their independence or objectivity? I'll leave it at that. But this is a really important issue, and it's not going to go away. It would be good that people feel comfortable with the approach the school system's taking. On the community health update, the state of Maryland is dealing with something we haven't seen in 40 years, a locally acquired case of malaria. Health experts say it's an isolated case. The victim was hospitalized and is now recovering, but that person had not traveled from a country where malaria is an issue. Additionally, bug traps found West Nile virus present in mosquito populations. No human cases yet of West Nile virus have been reported, but like malaria, the disease can be deadly. Spraying to kill mosquitoes near traps in Laurel began on Sunday. Maryland's not the only state seeing mosquito-borne illnesses. Northern Canada is currently warming at 3 times the global rate there, and mosquitoes are spreading disease among wildlife at alarming rates. Virus antibodies were carried by Arctic foxes, caribou, and polar bears. And for anybody who's been to Canada in the past, they already have a thriving, lovely mosquito population. So having more of them is probably not a great thing. It's no surprise that in an area where mosquitoes are common, that we have new threats to monitor and be prepared for. Mosquitoes are the most deadly animals in the world. It's kind of hard to fathom, but they kill like 725,000 humans a year by spreading diseases. I had no idea of that little factoid until somebody brought it to me. To best avoid mosquito bites, please remember to remind your audiences to tuck shirts and pants into socks to cover gaps in your clothing where mosquitoes can get on your skin. Stay indoors when possible, especially if there's mosquito-borne disease warning in effect, and use EPA-registered mosquito repellents when necessary. Before we get to this week's COVID-19 briefing, I'd like to encourage you to spread the word about back-to-school vaccinations. They are required for public schools and they can't be ignored. The county's offering clinics every Tuesday morning from now until the end of September at the Dennis Avenue Health Center, except for the week of Labor Day. You can also make plans to attend back-to-school immunization clinics this Saturday at Westfield Mall in Wheaton from 10 to 1, or by making an appointment at the School Health Services Immunization Center on Macon Road. Visit montgomerycounty.gov immunizations for more information. And next up, you see this chart of Montgomery County wastewater surveillance. And so you can see the spikes in 10-day rolling average and the daily average and increases in what we're seeing in wastewater. So as we expected, what you see in the population, you see in wastewater. So at least we know that there's a correspondence between the sampling we're doing and what we're observing in the population. As far as COVID goes, we continue to see a slow but steady rise of the number of COVID-19 cases here locally and across Maryland. Case rates and hospitalizations have been elevated over the last week, but we're not seeing the same impact in emergency room visits or deaths. And as long as those later points remain the norm, we can manage this as we're doing it now. It's, being vaccinated and have a heavily vaccinated population is certainly helping us. New vaccines are on the way. We expect them, I guess they're going to be a little bit longer than a month now, what I heard last. But the new vaccines will be based on the latest version of Omicron. And that should offer us additional protection. They won't be bivalent, at least as far as I understand it now. So I'm going to turn this over to Public Health Emergency Preparedness and Response Manager Sean O'Donnell.
Thank you, County Executive. So to go through the COVID report this week, I'll just preface it by saying it is similar trends to what we've seen the last few weeks. We do have an updated report from our CDC partners on the variant typing, and that EG5 continues to trend upwards as the proportion of cases. The volume of cases also are trending upward. You can see, again, this is more of a gradual increase. I remind you every week, these are PCR numbers. We know these case rates are much, much higher. We know lots of people are doing rapid test kits. We're happy to report that through our partnership with the Maryland Department of Health, we are resupplying our libraries in the county with free rapid test kits. So just want to remind our residents they can go there to get a test kit, or they can certainly go through their healthcare provider or whoever their insurer tells them they'll cover, and they can get test kits that way as well. We're seeing, again, gradual trends across the state in our PCR test positivity. And you can see across the entire state, we've all moved into that yellow territory. These are, again, much lower levels than we've seen in previous spikes, but they are gradually increasing. As far as, again, as our county executive mentioned, the hospitalization rates are some of our more concerning metrics. We've seen in the county, our hospitalization level has been about similar. I did hear some reports this morning from a few of our hospitals that they had a number of patients come in this morning. So these are numbers from yesterday. But again, our rates are elevated, but have held relatively steady over the last few weeks. What we're seeing across the state, you can see again, those hospitalization numbers continue to creep up. These are largely the acute care beds where we're seeing more COVID diagnosed patients. The ICU beds have held fairly stable. I hope I'm not jinxing that. We really don't want to see increases in ICU because, of course, those are more significant illnesses. We have not seen increased volume at our emergency departments. That's good news. We know we're getting closer and closer to those other respiratory diseases. A few cases of influenza have occurred across the state over the last week, but nothing major. I do want to remind folks, COVID remains far more deadly than almost any other infectious disease that we have on a population basis across the state. Again, this is about a week old, this data. We had 41 cases already in this month. I don't think this is even showing our August numbers yet, but we are likely to be over 50 deaths from COVID in the state of Maryland for this month. That's approaching the number of influenza cases we've seen across the entire year, influenza deaths, we've seen across the entire year. So just want to emphasize, when that new COVID booster becomes available, recommend people go to their healthcare provider to get those shots. And the county will be working with partners to make sure that's available to those who don't have insurance. Again, we'll start to share the influenza activity and the RSV activity as those reports come out, but we have not seen a high level of activity yet. It's just a few cases are beginning to occur. With that, I'd like to see if Dr. Davis or Dr. Bridgers have any additional things they'd like to add.
Thank you, Mr. O'Donnell. No additional comments for me this afternoon. Ready for Q&A.
Thank you. Nothing additional. I look forward to questions.
Okay, thank you both. And Mr. O'Donnell, members of the media, we're going to open it up right now for public health questions and general questions. And I do see that Adam Tuss, NBC4, has raised a hand already. Good afternoon, Adam. Remember, members of the media, raise your hand. Adam.
Good afternoon, and thanks for having this briefing. County Executive Elrich, back to the road project. Can you talk about, obviously you're not back at square one, but you're pretty far back. What does a realistic timeline look like now for people who are wondering when this construction is going to start? You know, you go to the Virginia side of the Beltway, you see all the work happening there, and people are going to wonder when that's going to happen on their side or in their neighborhoods.
Mr. County Executive, can you please unmute?
I said, I'm not going to make up an answer because I don't know. I don't know how long it's going to take to get to go through the approval process for the federal government for a grant. I don't know whether this is a 6-month process or a year process. And then they've got to get into the design of the bridge. And I don't know how far the design was under the previous governor, whether they actually got to the design phase or whether the Moore administration is going to have to start the design phase. So they know there are things I don't know. So I can't get you an answer, but if you're patient, I can try to get our folks to get answers from the state and get you those answers.
That's fine. And one follow-up just about transit, there's a lot of talk about that happening. What does that look like potentially across a new Legion Bridge? And is there any concern about, the link that would connect between Maryland and Virginia in terms of jobs that would go back and forth between the two?
Well, there's already an enormous amount of jobs that goes back and forth between Maryland and Virginia. That goes both ways. Both of our counties have large numbers of residents who actually work outside the county. So I don't view that as necessarily a jobs problem for either of us. I think it just makes either of us more attractive. I mean, a lot of county residents, if you work in Virginia, we get the income from your working in Virginia, and Virginia gets the income from people who work in Maryland. So to the extent that you have more jobs accessible, it's probably a net plus for both of our populations. But I think hopefully our side will be able to come in line, reasonably soon. And all the improvements Virginia is making aren't going to make any difference at all unless you unplug the bridge on both sides. It's like we're both heading people to, a stopper. And so both of us we've got to figure out how we're going to relieve the stopper.
Any more questions, Adam? You good?
No, thank you.
Thank you. Kate Ryan, W2P. Good afternoon, Kate.
Hey, good afternoon. Just to follow up on the tolls, I know Councilmember Kate Stewart had said she's disappointed by this because it doesn't seem equitable to her, saying that managed tolls by themselves are inherently inequitable. What is your feeling on that? And again, I don't know if you've talked to the governor since this rolled out, but has anyone pressed him on exactly how this might be funded? Because he himself has said that the state is facing economic pressures. It looks like federal money will have to play a big role, or the P3 model.
So this is complicated. The governor started with an incredibly expensive design. If anybody remembers looking at what he first put on the table and what they were talking about, it had stuff that was absolutely unnecessary that just drove the cost of this project up. They haven't gotten far enough into alternative design to understand, like, what would it actually cost to add a couple of lanes or reversibles to I-270? There was a very exotic approach for how to do it. There's a more common sense approach for how to do it. The cost differences between doing it the way other jurisdictions have done it that have minimal costs and doing it the way it was originally proposed are enormous. So I don't think they're going to know the true costs until they actually look at that. And I-270 is like the longest part of this project, because it goes from Frederick all the way down to the spur where it joins the Beltway. So I think they need to have the time to actually evaluate what they're going to do. They've got to evaluate what happens if the bridge opens, because a lot of the assumptions about where traffic backs up from, people are looking at the existing problem. They're not looking at it. What happens if the bridge is built? What does that do to the upstream backups that form behind the bridge? So I think all that's going to go into figuring out what this should actually cost. And then the state's got to decide, do they have the funds in the trust fund? Do they have the funds in the general budget to be able to support this? Do they have ways of raising the money? If they raise the money, let's be honest about it, it's going to cost taxpayers one way or the other. It's either going to be in a toll or it's going to wind up being tax-supported funding for the project. So we're all going to wind up paying something, I think, even no matter how you look at it. But hopefully they're going to take the time to evaluate all the costs before they make a decision about a toll. I'm not a fan of tolls. I would feel differently if there's a design where the regular riders do not get a penalty for, Hogan's proposal, again, proposed taking away existing lanes and tolling them, which pretty much guaranteed that anybody who didn't pay the toll would be in highway hell. If we do this in a way where, if there are ways to add capacity without taking away from existing drivers, it could be a benefit to both people. People who want to pay a toll could get a much faster ride than people who don't want to pay a toll would actually get a faster ride than they get now. Maybe not as fast as something that is separated from general traffic, but certainly faster than what they have now. And that's why I think it's important to continue to work with them as they design this project. Nobody wants this to cost more than it needs to. So I'm hopeful that we can get to a place where we don't need tolls. And if you were gonna wind up with tolls, I would never do this with the P3, because the governor is using the P3 to borrow money. So to start with, they borrow money at a higher rate than we do. And then they wanted a rate of return on what they were borrowing, which to me is a kind of astounding. You're going to get a rate of return on other people's money. That must be nice. I'm hoping that if we wind up, borrowing or needing money, we do not go to a P3 to get us the money. I think that would be a real mistake. You can do long-term bonds and pay for this over a long period of time, just like the P3 is going to pay for it over a long period of time.
Thank you. And then on the health questions and COVID, to Dr. Bridgers or Dr. Davis, do you get a sense that people, once we get the new vaccines, are going to be eager to line up and get those? Or is there kind of have we gotten so comfortable with, there's COVID, but as you say, that the hospitalization seems to be pretty steady, et cetera. What are your thoughts there? What feedback are you getting? And do you know how soon we might see those new vaccines?
Nate, I'll defer to Dr. Davis and let her provide the update for HHS.
It's a great question. I think we're seeing a little bit of both. I mean, there's certainly COVID vaccine fatigue out there, and folks have just kind of moved on and aren't thinking about it. And so it's really on us to raise the alarm. Not alarm, but the things that are available, the tools that are in our toolbox for prevention. As Mr. O'Donnell mentioned earlier, COVID is still one of the most deadly respiratory viruses that is out there. And when we compare that to what we see with flu, it is pretty significant. And when we have a vaccine in hand that can provide that protection from severe illness, protection from death, protection from hospitalization and ICU, who wouldn't want to take advantage of that? And so we continue to sound the alarm that vaccinations make a difference. They're helpful, and we really want to encourage folks to do that. When we look at Montgomery County over the past few years, as we've seen those trends go higher, we've also seen that because we have high rates of vaccination, it's not as bad as it could have been. And I think this is a community that recognizes the importance of vaccinations and is going after them. That in mind, part of our strategy for the fall is really thinking about who are the most vulnerable in our community, who are the folks that are most highly impacted, and targeting campaigns to make sure that they are getting vaccines, that they are available in areas that are convenient for them, and that, really wanting to make sure that communities, especially our Black and Brown communities, who have been so greatly affected by COVID, that are taking advantage of this resource.
Got it. And again, the date for the new vaccines, I know we keep saying fall, so in the next couple of weeks, maybe?
Well, Mr. O'Donnell, you want to speak to the latest you've heard?
I think the latest is that the ACIP, the CDC advisory group, will meet to review the efficacy data in late September. Once they review that, they'll provide guidance on administering that vaccine. I expect they'll likely say everyone who hasn't had a shot in the last few months should get a booster shot. But we'll get that specific guidance at the same time, and then it will roll out. And that rollout could take a few days, maybe a week or so. So I'd say conservatively, we should have some vaccine, hopefully at the very beginning of October, possibly sooner than that. And as people try to make appointments with their healthcare providers and other places, just be mindful that rollout's going to occur over the course of a few weeks. And so, again, I think that initial demand I think people are okay with saying, okay, I'll schedule my flu shot first week of October, second week of October, third week. We just don't want people to wait until they get to mid-November and then all try to get it right before the holidays, because we want you to have that immunity before this starts spreading around our community.
Got it. Thank you all very much.
Thank you, Kate. Members of the media, any other questions? Adam, your hand's still up, but I'm assuming that it's just that you did not put it down. Do you have any follow-ups?
Sorry about that. Nope, just thank you all.
Okay, no problem. Any questions, members of the media? All right, going once, twice? Guess not. Thank you, everybody, for joining us. Stay safe. Have a great afternoon, and we'll see you next time. Bye-bye.